Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning into the Tate Chronicles. Join me as we cut through the fog that exists at the leading edge of healthcare technology. My guest today is none other than Sandy Vance. Sandy is the president and founder of Counterpoint Solutions, which provides collaborative project and event management services for healthcare interoperability events. Sandy brings nearly 20 years of experience integrating the systems and business of healthcare. She's an evangelist and subject matter expert for standards-based health IT interoperability. Sandy, welcome to the Tate Chronicles.
Hi, Jim. Thanks for having me.
You know, I know that we've got a big event coming up in March, which is the Vive event in Nashville, Tennessee, and you're heading up the Interop Now Pavilion, which is going to be 26th through 29th at the Nashville event. And I'm really fascinated to talk to you because your leadership role at this event provides you with unique insight to vendors, providers, agencies, and all these entities as the process of digitization and sharing of data progresses. And so I'm going to be at the Vive conference next month, and I'm coming to the pavilion, Interop Now Pavilion. Can you give me an idea of what I can expect to see?
Absolutely. So the Interop Now at Vive Pavilion is really a place to be for those that are looking to advance access to healthcare data and the use of it through things like automated intelligence, machine learning, interoperability initiatives. Years ago, I've been doing these cross-industry, multi-stakeholder events since 2010. And many moons ago, when we were doing this at conferences, it was all about making the connection and getting the data from point A to point B. And it's really an exciting time as the world of healthcare digitization, it sort of transforms into true interoperability that allows us to build on having the data and really focus on what value we can add with that data through digital insights.
I can remember those. It sounds like every major conference every year in healthcare, there would be a interoperability section. And 10 years ago, the big event would be if a lab result could be sent from one system to another. But I think we're way past that in terms of, what can be moved, what's important that can be moved from point A to point B.
So true. And, what we're really focused on is instead of trying to do these coordinated use case stories where it's a fake story around a fake patient and we're showing, look, the data got from point A to point B. Now our goal is really to orchestrate the education so that healthcare CIOs and anyone from a provider or payer organization really can join in the conversation and learn what this modern world of interoperability looks like now and how they can advance their strategies to move the needle when it comes to patient care. So in this event, each of our half-day vignettes will sort of have a state of the issue around a certain theme in interoperability. So either like a government agency or a standards development organization or another industry expert. We've got several folks coming in from various consortiums like the Care and Health Alliance and the Civitas Networks for Health. So they'll talk about what they're doing, like what their focus has been in interoperability. And then we'll have the technology vendors actually showing what they can do in a real world use case. So they're going to be up there with a client from a payer or provider organization showing an actual story, the before and after implementation. What was the value proposition? How did we create value in this organization? How did we reduce costs, reduce, ER admits, all of those things that we really look to do from a tactical perspective to improve patient care? Like why, what did they do to have impact and and why it's so important that the CIOs pay attention to these interoperability initiatives that are happening across the industry. As you know, there's a lot going on, right? It's not, it's not about moving the data anymore. The data's free, fully liberated. Now let's make use of it in the best way possible. And so it's just an exciting time to be focused on interoperability.
The whole issue of interoperability, I'd like to take a couple steps back and kind of discuss it because everybody says, well, interoperability is a good thing. But just because it's a good thing or best practice does not necessarily mean we can predict when it's going to come into widespread use. The adoption of electronic health records really was promoted because of massive government financial inducements. What do you think it would take for the obvious advantage of healthcare data interoperability to truly enter the mainstream? Is it going to be incentives or adjustments to reimbursement, or, will it just seem like such a good idea that providers will do it?
No, I think there's going to be a lot of government involvement. I think there already is a lot of government involvement. Folks that come to the Interop Now Pavilion at Vive are going to, hear Alex Muggy from the Center for Medicare and Medicaid Services talking about their prior authorization rule that is requiring payer to provide a provider data exchange. We're going to have some deep dive conversations into that new attachments rule that's just come out. ONC obviously focusing heavily on digital modernization. The CDC is putting out a ton of funding around digital modernization right now. So, there's going to be a ton of government involvement, but I think it really is going to fall back to industry to help make sure these things actually work and make sure that we have a feedback loop. And that's one of the things that I aim to foster in this Interop Now Pavilion is we're going to have all these chief information officers from the provider organizations, and we're going to have all these technology vendors that are there, boots on the ground, making this stuff work all the time. Let's get them engaged in conversations with these rule makers, Mickey Tripathi, Alex Muggy, all of these folks that are coming. We're going to have Andrea Bennon from the National CDC NHSN project. So it's really important. I think it's going to take a ton of government involvement in the forms of these rules, but I think that they're going to need to continue to be informed by organizations like Health Level 7 International and by the entities that are actually having to make this stuff work in a very practical and tactical way every day. But from your question, I would say interoperability is here. We're doing this. And there are a lot of organizations that have already implemented standards-based APIs. There are tons of technology providers that are coming out and are facilitating this sort of advanced level of machine learning and insights on patient data that are improving healthcare providers' ability to meet patients where they're at every single day. So I think it's just going to continue to explode. Things like the national networks, of course, are going to help foster the improvements. But we're going to have to continue with that feedback loop because there's no single answer.
Right, exactly. And as the industry moves forward, you mentioned government or certainly some of the Medicare reimbursement schemes, macro-MEPs, those kind of things that for inpatients, the promoting interoperability, one of the categories where points can be gained for hospital systems is that they're hooked up to they can access the TEFCA network once it goes live. And so that is a promotion, certainly in that way. We haven't seen that on the provider side, individual ambulatory providers, but I'm sure that will be coming at some point. But one thing that sounds interesting about the Interop Now Pavilion is it's not going to be just salespeople. Nothing wrong with salespeople, but it's going to be actually folks coming from a provider background and or a technical background, really demonstrating how these things work potentially in a real world environment.
That's right. Not just potentially, but actually, right? So all of our premier and lead sponsors this year have been invited to bring an actual client where they have implemented their technology and had impact to share that story and talk about the before and after. So one of the really cool stories that we'll see is that CDC National Healthcare Safety Network has implemented this product called Link that helps them get the data, to and from hospitals that's necessary for some of the COVID notification stuff. And we'll actually get to see like what they were looking for, what they thought their problem was, what they implemented, and how they were able to really transform the way they're delivering that information because of the product. And I think that's so important because oftentimes when you're just looking at a demo, it's hard to understand how that is relevant to your particular environment. But I think that that's something that will really shed a lot of light on at this upcoming event.
Kind of shift over to cultural side of interoperability. Maybe not in an inpatient setting, but in an ambulatory setting, if a provider receives information from a network, whether it's an existing network or TEFCA, how universally is that data going to be trusted? And by that I mean is that the quality of that data. Now, this doesn't have anything to do with the plumbing or HL7 or fire or API or anything else. We know that a perfect example is there is a diabetic medication now that's frequently prescribed off-label because there may be weight loss as a side effect. And so it's covered by insurance. Some providers give some type of diabetic diagnosis, so the patient's insurance will cover that drug for weight loss. And so that is kind of my concern I have about data in this interoperability is really just going to move data around. It's not going to alter that data.
Isn't that so interesting, Jim? Yeah. Well, I'll tell you, one of the things that we're seeing right now is this explosion of data aggregators who are really looking to take all that data and parse it and clean it up for providers everywhere. And you're absolutely right. We've opened the pipes, right? The application programming interfaces, hopefully FHIR formatted, are now delivering all of the data necessary into these networks. And when someone pulls data into their EHR, they've got more than they can handle, more than they could, certainly more than they could process as a human, but in a lot of cases, more than they can process even with their systems. And so how I think this is going to be dealt with moving forward is with organizations like Availity. Availity was formerly they have this clinical solution, used to be Diameter Health. They've been doing this for years. They do what they call data upcycling, and they take that data and they parse it and they figure out, if you've got listed that you're allergic to penicillin, then your chart should also say you're allergic to penicillin and all of these off-brand drugs that are used, in the same instances, and I don't know clinically if that's an accurate statement, but what I'm trying to say is like they are doing the synthesis and the analysis on the data and serving it up in an EHR in a way that makes physicians super efficient at what they're doing. And I think that this is a critical piece of the puzzle. Credo is another one. They will also be at the Interop Now Pavilion demonstrating a case study, a use case, a real life implementation where they have really implemented this whole process of cleaning up the data and serving it up in an EHR with only the pieces that are needed. And you make a very valid point that, it's just like if we had, any kind of data aggregation is going to require some type of cleanup. And, we worked so hard for years and years and years to get data into an electronic format. And then we worked so hard to standardize that data. And there are gaps and there is much work left to be done. But I do think that there are a number of technology companies that are really picking up the ball here and aiding providers and payers in making that a much more manageable process. And those solutions will be available to actually see them live working in a demo, or hear about where they've been implemented, who's using them, and how successful that implementation has been, and the real problems with it, right? Like, nothing's perfect. There's no silver bullet, as we said before,
Right.
but these data aggregators are going to play a really key role as we move forward with this new free-flowing data.
I'm glad you brought that up, because I'll definitely spend some time with those vendors in your Interop Pavilion. You're right. The ability to make that data more potent, and clean it up and strip out duplicate things, all that kind of stuff. Before we go to the next thing, let me mention our audience. If you're just joining this episode, I'm Jim Tate, and today on the Tate Chronicles, I'm speaking with Sandy Vance. Topic is interoperability and the upcoming Interoperability Pavilion at the VIVE Conference, which will be in March 26th through 29th. One thing that you mentioned is, it's a good time to talk about TEFCA a little bit, because last week, the weeks are run together, it was last week and the week before, ONC announced the first 6 application approvals of entities that want to enter the testing phase and hopefully be designated as a quality health information networks for TEFCA. But it's really come to my attention that all QHINs, as they're called, are not going to be equal. Some of them are just going to serve up, receive requests, hit the other QHINs through the network, and deliver response with what data they find. Some of those QHINs are going to actively work to clean up the data. And so that's going to be fascinating to see who does what in the QHINs. It's going to be a real value add proposition among some of them.
Yes. Yep.
And there's a 12-month deadline on that. You've been involved in interoperability so much. The regional health information organizations, health information exchanges, all these different entities. How big a thing do you think TEFCA is, or the potential for TEFCA, a network of networks?
Well, I think it's an important next step forward. And I do think it's going to be interesting to see how these networks manage the cleanup of the data, because for all the reasons we just talked about. Sorry, I almost stole your thunder there, didn't I? Like, we need to, that data is going to have to be cleaned up. And as you said, some of those QHINs plan to do that type of data cleanup. Some of them don't. And it'll be interesting to see. I think time will tell. I mean, right, we have a whole year of testing to get ready for this. I think that there are going to be some challenges with it as they go through that testing. Things like figuring out how the consumer consent impacts downstream data usage, and folks getting, different providers getting patient data that, what that authorization looks like for them to get that data. I think it's going to be an important thing that's going to need to be hammered out over the next year, because I don't think that the details are figured out yet. So I think that there's a whole lot of questions yet to be answered to determine, like, is this really going to be, the national solution, or is this just going to be another, and I don't say just lightly, like, is it going to be sort of the next step in, getting folks access to this data? And how big it is, I think time will tell. It depends on how well they work through sort of the remaining issues.
I know it's going to be fascinating to watch through this year and next year also. Now we've talked pretty much about interoperability of providers receiving data, from whether it's from other providers or from a network or from a lab or wherever. But part of TEFCA is this individual, where individuals have the ability to access TEFCA and I guess get the same data that a provider would pull on. I don't know. Do you know if the QHINs themselves, each one of them must offer that, or Will there be charges for that? You have any sense about the individual?
Yeah,
aspect?
I think it's going to be. Yeah, I think it's going to be a mixed bag on how these solutions roll out. Because to your point, these QHINs are far from equal, and so when you've got organizations like NextGen Healthcare, who's a large electronic health record and is going to be serving their providers with the data from the networks, it's very likely, I think, that the average consumer, you or me, will access our data through those portals and those apps that they already have set up, but just in a more enhanced way with more data from other sources, right? But I think that there are also, and this is another area that I'm seeing in the last few years, this huge rise in systems that want to be the digital front door, systems aggregators that are offering basically an app. So now I'm talking about your Be Well Health type of solution, right? Where they've got an app and you can go into the Be Well app and you can expect to see all of your data from the various networks. And you can even, get additional services like alerts and notifications about wellness type, exams that need to be had. You can set things up like, patient advocate type of situation. If I'm taking care of my dad, I can get my dad's records. My dad can authorize me to see his stuff. So I think that this is a whole new world in terms of, and Jim, we've been at this a long time, buddy. We just talked about this a bit ago. This is a whole new world in terms of, I'm not just looking to access my data from this single provider in this one portal with a login and a password for each different, my podiatrist and my cardiologist, they all have a different system. This new world is really one-stop shopping through a system that is not only going to serve me up my upcycled data, my cleaned up data, but it's also going to afford me these additional service add-ons like the notifications, like being able to, easily manage my children or my parents' care. So I think it's, it's really cool. And it's going to be exciting to see how these different technology providers leverage what's been made available to them through these networks.
Yes.
And I look forward to sharing that. We've got a really powerful agenda set up for the Vibe event in Interop Now. And I think it's just going to be sort of a 3-ring circus almost of, here's what's possible. And when we start to get outside of our comfort zone and stop assuming what was, I know when I used to implement electronic health records back when it was still exciting to do point-to-point stuff. And we would go into a physician practice and we would say, and we tell the staff, we'd say, whatever you do, don't just assume that we should build your workflow around what you're doing in a patient chart. We want to reinvent, we want to stop and think about what's our goal and what's really the best way to get there with this new functionality, this new capability. You're going to have an electronic health record at your fingertips. So let's not just digitize a bad workflow. Let's rebuild the workflow, understanding what's possible. And I think that that was back in 2002 to 2010 timeframe, right? And now in 2023, we can look at it and we can say, you know what? Let's not assume we know what interoperability is, meaning a list of all your problems, meds, and allergies. Let's reimagine what it means to have digital healthcare and interoperability. And let's really consider the prospect of meeting the needs of our growing population, of the people that have significant, health disparities in the amount of care or level of care they're able to get because of things like social determinants of health and, people of color and people in impoverished situations. How can we better serve them? How can we, take this idea of universal health care and making care accessible to all and leverage the data to actually do it this time? Right. And so, it's really, really good stuff. And I think that freeing the data has been a monumental task on the part of
Yes.
government agencies and commercial organizations alike. And I'm so excited because I'm seeing some amazing next level stuff with machine learning and all of these various, data aggregators that are adding services.
Well, we're almost out of time, Sandy, but I want to again remind our listeners that the Interop Now Pavilion, which will be at the Vive event, the hours for that are Monday, 8 to 6:30. That's a long day for you. Tuesday, March 28th, 8 to 6:30, and Wednesday, 8 to 1 p.m. And for information, folks can go to the website, ViveEvent, ViveEvent.com, ViveEvent.com. To our audience, thanks for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Sandy Vance. Sandy, thanks for coming aboard today.
Thanks for having me. What a great time. I hope to see you all at Vive in Nashville.
You'll definitely see me. I'm looking forward to it. You can find more information on this show's program page at healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.
Tate Chronicles transmission ending now.